What is coated tongue in enteric fever? A coated tongue is a common physical sign associated with typhoid fever. The tongue may appear white or whitish-yellow, often with a red border. This coating is caused by inflammation of the tongue surface and the buildup of debris and dead cells. Let's discuss it in detail. What is typhoid fever? It is a bacterial infection caused by Salmonella typhi. Typhoid fever is spread through contaminated food and water. What is a coated tongue? In typhoid, the coating is often described as white or whitish-yellow, sometimes with a red border. Diagnostic clue. A coated tongue can be a helpful clinical marker for typhoid fever, especially in the early stages when other symptoms may be less specific. Other symptoms. Besides a coated tongue, typhoid fever can cause a range of symptoms including high fever, headache, abdominal pain, diarrhea, and sometimes a rash of small, pink spots called rose spots. Significance. The presence of a coated tongue along with other symptoms should prompt a medical evaluation for typhoid fever, especially in individuals who have traveled to or live in areas where the disease is prevalent. Which other disease has coated tongue? A coated tongue is a common symptom of scarlet fever and typhoid fever. In scarlet fever, the tongue may initially be white, then turn red and bumpy, resembling a strawberry. This bacterial infection, often associated with strep throat, causes a distinctive red, sandpaper-like rash and a white or strawberry tongue.